Hello everybody. Today we're going to talk about my client. My client's name is Jenna. She is a 24-year-old Caucasian female and she is a single mom of 2 daughters. Presenting problems with Jenna include that she's been struggling to maintain her mental health. She's been lashing out at loved ones and she's not really sure why. She's not having the patience that she needs for her children, and she's feeling as if she's getting a little too angry. And she's also experiencing symptoms like mood swings, irritability, depression, social isolation, and then overall emotional instability. Her family and health history includes a long history of depression and anxiety in both herself and her family. The client has been on medication and in therapy on and off since she was 7. And then she's also had to see a dietitian because she's had issues with maintaining a healthy weight throughout her life. And then the client has felt as if she's got some form of personality disorder. However, she's never been diagnosed with one. So some special conditions and cultural implications with this client include that she grew up in a household that's toxic with a father that's an alcoholic. Client's parents both work multiple jobs and they haven't been around much and still are not. The client's mother is not very supportive of her mental health, and she's also gone through the loss of her grandmother that she was very close with. She's experienced childhood trauma, and she lacks the ability to have the positive coping skills that she needs. Some strengths for the client include that she acknowledges that she needs help. She has a good sense of self. She's empathetic, and she strives to be the best mom that she can be, even though she feels as if she is not right now. Weaknesses include resistant to medicine, and she's also has very little family support. Assessments that were done include the McLean screening instrument for BPD. That's borderline personality disorder, and she did score above the cutoff score, so she has been diagnosed with borderline personality disorder. She also did the generalized anxiety disorder 7, and we found that she had severe anxiety as well. She scored a 21 on that. And then we did a drug abuse screen just to make sure that there wasn't any issues with substances, and there was not, so we were able to rule that out. We did a suicide assessment as well, and it was found that there's no risk for suicide right now. She's not showing any signs. There's no plan set into place. And with that, that's where we got our decision for that. The diagnosis was borderline personality disorder, like I stated before. And in the DSM-5, it states that the client needs to have 5 of the 9 criterion, and she had 7. The treatment plan includes that she will go to weekly therapy. They will use the theory of dialectical behavior therapy, also known as DBT. And goals that she will have includes working on being able to build stronger relationships, act in self-care daily, find ways to focus on her emotions in a more positive way, and then she needs to be working on controlling mood swings. Barriers to her treatment could include that she is apprehensive about medicine because she has been on it before and she doesn't want that dependency. She also, being a single mom and a working single mom, might not always have time for her therapy. Her insurance may not cover the copays, and she might not be able to afford them. And then she also worries a lot about the stigma that's associated with mental health, so that could be a barrier as well. Ethics that could be considered in this case, I mostly talked about the issues with her children and how she's feeling as if she's being too aggressive as a parent. I talked about how if the professional or I were to start to worry about the safety of her children, that I would have to act accordingly. And that with the cultural differences, I would need to understand single mothers and just the issues and the concerns and the difficulties that they deal with on a day-to-day basis. And then the prognosis for my client is fair to good. She knows she needs help. She wants to get help. So if she continues to go through her therapy, she has a good chance of maintaining this healthy mental health. However, if she does not continue therapy, then this could be a different outcome. And that is all I have. Thank you guys so much for listening.